the second colloquium this term, and this one is sponsored by the Center for Healthy Aging Research, and my name's Karen Hooker, and I'm the director of the center. And I am just so very delighted that we got Margaret Neal to come down from Portland State University. Margaret and I have been colleagues for years. I think you might have even introduced me to your colleagues when I came here 18 years ago. So we're long-timers here in Oregon. Margaret is director of the Institute on Aging and also professor of community health at Portland State University. She also oversees the Institute on Aging's Aging Matters Locally and Globally initiative. She leads a service learning program to Nicaragua. Is that in spring break?
No, at the end of the school year.
Okay. And also directs the Oregon Geriatric Education Center, and OSU is also a partner in the OGEC. Dr. Neal teaches graduate courses in gerontology and also data collection methods. Her most recent research is focused on the challenges and opportunities of managing paid employment and unpaid elder care, the characteristics of age-friendly cities, which we'll hear about today, transportation options for older adults, strategies for promoting healthy aging, and aging in developing countries. So let's please welcome her today as she talks to us about age-friendly communities.
Well, it's a real pleasure to be here with you today, and what I do want to talk about is some work that we've been doing in Portland over the last several years related to age-friendly cities. And what I want to do in this presentation is I'll provide you a background of the World Health Organization's Age-Friendly Cities project. I'll describe that a little bit. I'll talk about how we implemented the project in Portland, what we did, how we became involved, just a few sample findings, talk a little bit about what happened next. We'll talk about why I think it happened and what's next after that. So the project, the World Health Organization project, began back in 2005 as an idea at the International Gerontology and Geriatrics Conference in Rio de Janeiro. And it was a result of discussion about various countries from around the world trying to implement the Madrid plan for aging, and some frustration that was being expressed, especially on the part of developing countries, that not very much progress was being made on accomplishing the goals of that plan. So they thought, let's do something related to age-friendly cities. And so this idea came about. The World Health Organization gathered together with particularly the Public Health Agency of Canada as a lead organization to implement the project. The World Health Organization has an active aging framework, and can you see this slide in the back? It's a little bit light, but basically the active aging framework says these bubbles on the outside are determinants of active aging, and I'll just tell you what they are. Economic determinants, health and social services, behavioral determinants, personal determinants, the physical environment, social determinants. And all of those factors together impact on how optimally we age, how active we will be as we age. And differences, individual differences in each of those areas will affect life expectancy, health status, and well-being. So this active aging framework by the World Health Organization is consistent with the ecological model, which tries to explain individuals' behavior using a social systems approach, emphasizing design of flexible, changing environments that can be manipulated, shaped, and altered. So when we're talking about environments in this context of age-friendly cities, it's really important to understand that I'm not just talking about the physical environment. I'm talking about the social, the economic environment as well. The World Health Organization project, initial group of advisors met a year later after the Rio de Janeiro meeting in 2006, and they developed a protocol called the Vancouver Protocol that they wanted the cities who decided to participate in their study on age-friendly cities, they wanted those cities to follow this particular protocol. The purpose of this study was to identify concrete indicators of what constitutes an age-friendly city, and then to produce a practical guide and a checklist. And then those documents could be available to the cities, not just those who participated in the study, but any city that was interested. For the cities who participated in the project, their goals tended to be more local in focus, and to identify the needs and the gaps in services and in problems in the environment, and then ideas for suggestions for changes, so that those cities could become more age-friendly. So I've used this term a lot now, let's define it. So the World Health Organization defines an age-friendly city as one that is inclusive, accessible urban environment that promotes active aging, back to that active aging model. It emphasizes enablement rather than disablement, and it's friendly for all ages, not just age-friendly. So even though the title implies it's for older adults, it really has a focus across the life force. These 8 features of urban life are part of the WHO Vancouver Protocol. What was intended to happen, and what generally did happen in the cities that implemented the protocol, was that focus groups were held. And in those focus groups, which were held with older adults, service providers, government providers, nonprofit organizations, and business leaders, to all talk about positive features in their particular city that contributed to age friendliness, negative features or barriers, and suggestions for change. And those 3 general areas of questioning were asked about each of 8 topic areas. And those areas, I'll start here with outdoor spaces and buildings. So outdoor spaces and buildings, transportation, housing, and then we get to more of the social environment. Social participation, respect and social inclusion, civic participation and employment, communication and information, community support and health services. So those were the 8 areas. And I'll tell you right now that when we did implement it in Portland, these focus groups, especially with older adults and family members, took almost 3 hours to cover all of those areas. So it was big. I mean, not too surprising when you think about asking each of those 3 questions for all of those 8 areas. The project sites were recruited through the informal network of WHO staff and project leaders through connections that they had to municipal leaders, and through promotion of the project at professional conferences. And as I said, focus groups were conducted. They were conducted in 33 cities in 22 countries. Portland was the only U.S. city. After the end of the project, New York City also collected data and contributed to the project, but it was after the original project was concluded. And the cities themselves were really quite diverse. So 19 of the cities were in developing countries and 14 in industrialized countries. There were some areas within 7 megacities. For example, Rio de Janeiro, the neighborhood of Copacabana, which is larger than the city of Portland, participated in the study. But there were also smaller cities and communities and neighborhoods that were involved. And we'll talk a little bit more about this sort of issue of unit of analysis in a minute. So this is just a map that shows the reach of the project. It truly was global in nature and represented, I believe, almost all continents in the world. You're probably wondering, okay, how did all those cities in developing countries participate in this project? Because not only did they have to collect the data, there was a requirement that everyone come to London in March 2007 to get together to talk about their findings. And so that travel money had to be found. And so Help the Aged UK was a major funder, Help Age India was a major funder, and the Public Health Agency of Canada. There was no funding for our project in Portland, and the project was done with my ace graduate student and me. We were it. So I mentioned the meeting in London, which for us was a great joy, although we were analyzing data still in the hotel room once we got there, I have to admit. The timeline for the project was really short. We were invited to participate in November of 2006, and we had to have all the data collected and presented in March of 2007. So any of you who have done a qualitative research study knows that that's a pretty short timeline for all of those different focus groups. And this photograph is just a picture of the major leaders of the project and our small work group. The focus group tapes were transcribed and data were analyzed at each project site. And as I mentioned, each site was responsible for identifying the age-friendly features in that city, the barriers to age-friendliness, and suggestions for improvement. And then at the end of the project, a small work group assembled and tabulated the data from each of those 33 sites in order to come up with this Global Age-Friendly Cities Guide. And that guide and the checklist are both available on the web. If you just search Age-Friendly Cities WHO, you will find it. And they're nicely produced documents. The checklist, that's a little tricky because if you imagine the types of differences that you're likely to find between developed and developing countries, finding some commonalities you would think could be quite challenging. But there were some. Problems with sidewalks were pretty universal, either not going anywhere, starting and not going anywhere, or being broken. Another big one, interestingly enough, was bus drivers. And how bus drivers, you've probably noticed that sometimes bus drivers are in a hurry. And so you mount the bus and you get in and the bus just takes off. Really bad idea for older adults who haven't managed to get a hold, and they can be thrown to the floor. So there's training needed of bus drivers. Those are just a couple of examples that were universal findings. On October 1st of 2007, the WHO wanted all of the cities to launch their findings. And the WHO launched its findings as well in Geneva. And we launched, and in London. And we launched our findings in Portland in the City Hall on that same day with government officials and community folks. So let me tell you a little bit about our specific project. And I'll start with talking about the Institute on Aging. The Institute on Aging was established in 1969, and it's actually one of the oldest aging research centers in the country. At that time, there was a lot more federal money available through the Administration on Aging. There was money not just for research and education and service, but there was money for training. And so you could actually apply to get training funding as a doctoral student or a master's student and get special training in gerontology, and I benefited from that program. So there are many people throughout the country whose names you might recognize who were part of that program. Nancy Whitelaw, who was the Director of Research for National Council on the Aging and the most recent President of Gerontological Society of America. Terry Fox Weddle, who was the Deputy Director of the National Institute on Aging, and also a former President of Gerontological Society of America. Donna Lynn Enfield, who's now at George Washington University. So a number of names who you probably recognize came through that program with that funding. Unfortunately, as I'm sure you all know, it doesn't exist. Or you would have applied for it, and some of you would have gotten it. Our university's motto is "Let knowledge serve the city." Many of the faculty at Portland State have a great interest in doing applied research. And certainly this research is applied in nature. The Institute is located within the School of Community Health in the College of Urban Public Affairs. And there are two other schools in that college, Government and Urban Studies and Planning. And from what I understand, that college is unique in its assembly of those different disciplines together. And you can get a joint Master of Urban and Regional Planning with an MSW degree, for example. You can get a joint Master of Public Health and Master of Social Work. You can get Master of Public Health and Master of Regional Planning combined degrees. And we have doctoral programs as well. So if anyone is interested in that, let me know later. The Institute on Aging has a background in doing research of this nature. We think we were the first organization to do a report on planning for an aging society back in 1994. And that was done in concert with the American Planning Association. But since then, we've done some other projects too. So this might have been part of the reason that Portland was selected for participating in this study. But I think the real reason was this, that Portland is known as a capital of good planning, has a reputation for its planning, and yet, if you dig into what Portland has done, you'll see that there's nothing in regard to what they've done, with the exception of some very innovative programs in parks and recreation. So Portland, you think of Portland when you think of planning practices, so maybe that's one reason they invited us to join. I think the reason that we were invited to join is we had worked with Martha Pelaz, who was the Regional Director of Aging and Health for the Pan American Health Organization. And we had worked with her on our Nicaragua program. So she knew us, she knew the nature of the work that we had done in Portland and Portland State, and they called us and I said, gosh, this sounds like too great an opportunity to pass up. But it's pretty serendipitous. So we were invited to participate in fall of 2006. We presented in London in 2007, launched in October. And the next year we presented at City Club with Bill Novelli, who was at that time CEO of AARP. So that's kind of the beginning of community interest in this topic. I just wanted to give you an idea of the advisory team that we pulled together. My graduate student is Alan De La Torre, some of you know him. And then on the team, we had representatives from another faculty person from the Institute of Aging, but this is actually wrong. He's with Bloom & New, a private consulting company. Ken Calvin was our senior rep and advocate. Nancy Chapman, School of Urban Studies. AARP Oregon, School of Community Health. Elders in Action, which is an advocacy organization. I don't know if any of you have heard of them. Oakfield Estates and Portland Community College. Actually, your mom. And Multnomah County Aging and Disability Services. So it's a group of people. We needed these people to help us decide the issue of unit of analysis. Remember I said we were going to talk about that issue of unit of analysis again. So we gathered some baseline data for the city as a whole to try and identify where do the older people live in Portland. Should that be the way in which we make our decision about how we where we conduct our focus groups and with whom? Another criterion of the World Health Organization was they wanted to be sure that we recruited low income and diverse older adults to participate in the study. And so we looked at the map with our advisory group, talked about it. You know those domains. Oh, wait a minute, I must have cut out. I cut out a slide, so let me just tell you what's on a slide. In deciding about unit of analysis, we didn't know whether to do, like, over in East Portland. East Portland is an area that's low income, it's very diverse. It's the source, or it's the target location where a lot of people have moved out of inner Portland because it's become expensive. So they move out, so you've got a lot of diversity, you've got lower income out there, and a lot of need for infrastructure development. So we thought, well, maybe we should focus on East County, East Portland. Ultimately, what we did, however, is we decided to draw our participants from the city as a whole for one primary reason. and two, actually. It was, we didn't have very much time, and so we wanted to take all comers who wanted to participate in the study once we announced it. And two, we thought we would have more political play, more influence if we were talking about Portland as a city as a whole as opposed to just a neighborhood. And in fact, that was the case. That's the way it's worked out. So I just want to highlight one finding from each of those 8 areas because we don't have time to go through all of them. So the first area was outdoor spaces and buildings, and the suggestion that was made, because it seems like that's the best way to talk about it, is what suggestions for changes were made, which is even more natural features and green spaces were desired with particular attention to accessibility. So Portland has a lot of parks. Older adults and service providers and business leaders and government folks all like the fact that Portland has a lot of parks, but they're not all accessible, and there aren't parks evenly distributed throughout the city necessarily. There are some areas that don't have as many of them. And there are some issues with some of the parks, safety issues, whether you can sit, is there a bench to sit on, that sort of thing. So there were some improvements needed and additional parks that were desired. With regard to housing, by far and away, the comment that we received most often was people wanted affordable housing, and second most common question was people wanted more accessible housing. Both of those are difficult to find in Portland. And this quote was from a design expert. She said, "A reporter called me and told me he was writing an article about new homes in the Portland area. Brand new construction built to be accessible." And I laughed and I said it would be a very short article. Not much building going on in the way of accessibility. Starting to turn around, but not at the time we collected these days. Another comment that I wanted to share about housing, because this comes up continually. Gardening is really important to people in the Northwest. And this woman, one of our older adults, said the smallest balcony is a godsend. Our balcony is only 41 inches. I had a full garden out there. I brought in dirt and built it up. It was a concrete floor. I had a wonderful garden. I was told I had to get rid of it. Well, you can't put mounds of soil on concrete balconies because they're not built to withstand the weight, apparently. So she had to get rid of hers. But there are things that we can do to garden on balconies. But gardening is important. The outdoors is important to people. Transportation, regional transportations were considered very age-friendly. Portland's known for a decent transportation system, probably the best in the U.S., but in many ways, but not from the standpoint of globally. I mean, we fall so far behind in the European city, for example. But nonetheless, people like our transportation options, but they did suggest a number of improvements, not the least of which had to do with safety on the light rail. They're particularly out at, I don't know how many of you know the areas of Portland, but out Gateway, which is on the east side of Portland, there was a lot of crime that was happening at the light rail stop there at Gateway, kind of behind the building. So they made some changes in the structure, made them clear so that illegal activities couldn't occur like behind the building. There's drug dealing and things like that. Another change that was a direct result of our study is someone talked about how on the light rail trains, not just one person, a few people did. On the light rail trains, at that time there was always at least one accessible car. Now I think all of the cars are accessible, but then there was one. And the problem was, it wasn't always, not the light rail train, the streetcar, sorry, Portland streetcar. It wasn't always in the same place. I'm going to go back. It was the light rail. It wasn't always in the same place. So the train would pull up, and if you weren't in your wheelchair at the right spot, the train pulled away without you, because it just doesn't stop long enough. So they changed that immediately once we presented to TriMet, and they moved the card, so now everybody knows where it is. Social participation, we have a lot of opportunities for older adults to become involved, and particularly educational opportunities. So, and I think here at OSU too, people age 65 and over can audit classes for free now on a space available basis. Portland State had that program back in the early 70s. So we have over 800 older adults who audit classes at Portland State every term. And PCC has a program too. One older adult had a great suggestion. She said, one of the things I do is give every new person in my building, and she was in an apartment building, a ticket, and tell them to get on the bus and ride the entire route to see what they could do, where they could get off. It's a very convenient bus. So in other words, help people understand what their transportation options are if they don't want to drive or they can't drive. In terms of respect and social inclusion, people talked about how language matters. And they liked a couple of terms that they had seen being used in Portland. One of them was TriMet calls, or at least they did, called older adults their honored citizens. And they got a discount, and another term that people talked about liking was, instead of long-term care, long-term living, which has conveys a really nice sense of it. And then also organizations were encouraged not just to have advisory members who on their boards or whatever who were older adults, but to take care to listen to those older adults. And also to reach out to sort of beyond the sort of, 20 or 30 older adults who are volunteering for everything in the city, reach out to areas and to people who haven't been included before, which is not easy to do, but to make a real effort to do that. In terms of civic participation and employment, there are employment opportunities and volunteer opportunities for older adults. But one of the things that people talked about most in regard to employment was discrimination, age discrimination that they had encountered. And remember, these people are, for the most part, well, we had two sets, 65 to 74 and 75 and over focus groups. They were talking about how their adult children were experiencing age discrimination, starting in 40, 45, 50. So they were asking for education of employers about the value of hiring older adults in their workforce. And this is a picture of New Seasons, because New Seasons, that chain does, or it's not a chain actually, it's locally owned, does in fact hire older adults. Communication and information. The suggestion was made that yes, it's great to have all these electronic newsletters and communicate with people electronically, but please, please, please don't get rid of all the print announcements, all the print newsletters, because, as you know, not all older adults are computer literate or want or are able to get their information that way. So while ultimately in the future, in all of our lifetimes, we probably will see that happen, but now we're not there yet in terms of going totally electronic. And then finally, with community support and health services, people really like the idea of having services connect with one another. So have doctors know about community resources, have the different community resources know about each other. We tend to operate in silos at the university. Similarly, the service providers tend to operate in their silos, and they don't necessarily know what the whole range of options is. So what did we do with the data? Well, one thing that we did with the data was at the end of our data collection effort, we got to go to London. That was fun. We got to have the launch in October at City Hall. But an effort called the Vision PDX initiative was underway at the suggestion of Mayor Tom Potter. This was his program. It was a community-led initiative. And there were a series of town hall meetings, and the idea was to create a vision for Portland. And so those comments came out, or a report came out, and comments were solicited, like what's missing. And so we added some of the suggestions that we had received as part of our Age Friendly Cities project. And those got incorporated in the Vision PDX plan. We joined a healthy planning work group to try and make sure that some of the issues that we'd heard about got disseminated to the community. In 2008, Mayor Sam Adams was elected and took office in 2009. And he started his own visioning effort, which was called the Portland Plan, which was overseen by the Bureau of Planning and Sustainability. And that plan was originally intended to become Portland's comprehensive plan, which is the 25-year, this is what we are going to do in the city of Portland. Not just a vision, but actually writing code around these issues that are presented in the comprehensive plan. But it evolved into an effort intended to inform the plan. And this is a piece that I don't fully understand how that happened or why, but it did. So back sort of behind the scenes, the WHO's project finished, and the WHO got inundated with requests from cities and communities from around the world saying, we want to know more about this. We want to do this project. We want some help in doing it, so what are you going to do about it, WHO? You sort of opened this can of worms. Well, the WHO decided to create a global network of age-friendly cities. And it would be an online community so that people could access information, communicate with one another, and they would post their tools that not only did the WHO develop, but also that the individual cities that had participated in this study had developed. And ultimately, they had to add communities to the title. So I was at an International Federation on Aging meeting in Melbourne where there was a group of the participating cities, the original ones in the Age Friendly Cities project. And there were a bunch of people who had attended this just general IFA conference too. And there was practically a riot from these people saying, we want you to not just address cities. What about small towns? What about small communities? What about rural and remote? And the head of the program then was John Beard, and he says, nope, we're not doing it. And I thought, wow, he's got guts to stand up in front of this group of people saying, we're not doing that. Well, he did. So now it's a global network of age-friendly cities and communities. And really, the goals are to do this, to provide the technical support and training, and to link cities together. In order to participate in the network, you first have to do this baseline assessment, which Portland has already done, and all those other 32 cities have done, of what are age-friendly characteristics in the city, what are barriers, what are suggestions for change. Then the members have to develop an action plan for addressing the changes needed and identify indicators so they'll know whether they've made progress over time. Then you implement the plan, then you evaluate your progress. So it's essentially a 5-year timeline. So in spring of 2010, right after the announcement was made by WHO of the network, we went to the city and the mayor and said, let's apply for this. This would be cool. Let's do this. And basically his staff said, okay, you write the application and we'll sign the letter. So that's what happened. We wrote, and so I'm the contact person because, which in the end is a good thing because he's not the mayor anymore, right? Right. And that's one of the things that I'll talk about is changing leadership and the impact of that on policy and practice. So anyway, we were accepted that summer, but we received formal acceptance the following summer. And this is when we went to City Council and presented the certificate of membership in the global network to the mayor and the city councilors. And then there was an age-friendly conference, the first one devoted just to that in Dublin, Ireland in 2011. And municipalities from around the world signed that declaration. And at this point, we thought we need a new advisory council because now we need to develop this action plan since we're a member of the network. And who should we get as our advisors? And so we had a lot of the same people, but then additional ones. So representation from the city and the county, the mayor's office and commissioners, a number of local nonprofit groups, And these are groups, the nonprofit groups that we work actively with: AARP Oregon, Elders in Action, Coalition for a Livable Future, United Way. Hands on Greater Portland is a volunteer organization that matches people who want to be volunteers with organizations, and now it's part of United Way. A group called Aging Artfully and Bridge Meadows, which is an intergenerational living program. There are foster kids living with families, and older adults live in this community as well and help provide the care for the foster kids. So it's really a very interesting intergenerational living model. And then Ride Connection, which is transportation options for older adults. A number of academic partners. I'm going to skip through this. Public sector collaborate. Well, maybe I won't. So within the school, I already talked about all the different schools in our college, but we have a relationship now with our Office of Research and Strategic Partnerships, thinking about how we can move this agenda forward. Department of Architecture, there's an Institute for Sustainable Solutions at Portland. We've had international visitors come and be with us for a while. We're working with Orchitect, the Oregon Center for Aging and Technology. And OSU Extension has a similar project called Engage in Clackamas County. And that's been a really neat program. And then WSU has worked with us on our project as well as Clark County's program related to age-friendly cities. So in the state of Oregon, there are a lot of communities working on similar issues. And they may call their projects something different, but there's really a lot. I'd say there's a groundswell of interest in the topic. So I mentioned the Portland plan before. Mayor Adams, at the time that we went to ask if the city could apply for membership in the global network, his staff said he wanted us to be on his Portland Plan Advisory Group. And I thought, well, that would be interesting. So we said yes, we being this one graduate student and I. So we said yes, we would do that. And honestly, our role was to go to countless meetings. I should have kept track and sit there and listen and say, what about older adults? Have you thought about how the environment impacts older adults? Have you thought about the strengths of older adults and what opportunities are presented by our aging society and how we can utilize older adults as resources? Have you thought about the needs of older adults? So, time after time after time, meeting after meeting after meeting. So the draft plan was released in March 2012, and it contained nothing about older adults. And I couldn't believe it. I mean, we read cover to cover, nothing. So I thought, well, what do we do? Because what really we need to just call somebody and scream, but that wasn't going to work. So we wrote written comments, and we went line by line through the plan and made suggestions for how we could incorporate language about strengths and needs of older adults in there. It was a long document, and ultimately we got a call from the Bureau of Planning and Sustainability and said, yeah, we remember you guys. We remember you guys sitting in those meetings, and you're not the only ones who kind of have a problem with the draft plan. And I said, oh yeah, we know, we are not the only ones. So they brought us, AARP Oregon, Elders in Action, the Portland Commission on Disabilities together, and we all sat in a room and hashed out what could be done with this draft Portland plan to fix it. And in the end, we got a page as well as specific action steps. So this page called Portland is a Place for All Generations. So researchers can be advocates and can make a difference. Now, whether anything happens, you'll see. But we have this page here, and now these particular action steps are in various places in the plan. And the first one is develop an age-friendly city action plan, which is the requirement for our membership in the WHO Global Network of Age-Friendly Cities. So that's in the plan. Another one that's really important that came out from our findings in the study is prioritize expansion and availability of accessible housing. Concentrate on age-friendly, accessible community hubs, which are called neighborhood centers now. Foster safe and accessible city quarters. So these things that are below don't necessarily say age-friendly or say older adults, but there are ways in which we will, in fact, be able to incorporate language about older adults ultimately, in some of them anyway, in the comprehensive plan. So we mentioned that the mayor changed. There had to be an election for the new mayor. So our advisory council actually said, what about doing a forum with the mayoral candidates and asking them questions about what they're going to do to increase Portland's age friendliness? So basically, it was a stroke of genius, I thought, on their part, because the candidates had to get up to speed on what age-friendly was, and we met with them and talked with their staff, and then they got to present their platform, and then after that mayoral candidate, and then that gave 200 people in the room about a chance to see who they'd like to vote for, based on at least what people said about age-friendliness and how they would work to make Portland age-friendly. And then, since they were already there, we thought, well, let's have a community forum and let people talk about what they think age-friendliness is, and just do some instant polling. Because AARP Oregon has these clickers. If any of you seen the clickers, they're really a great way to help people engage in a topic. So what we did is we gathered information about age friendliness from these 180 attendees, and we asked them just real simple questions at the beginning of the forum so they could get used to using the clickers. So we asked them to say which gender they were and told them, press 1 for this and 2 for this. Their age, which part of Portland they lived in, and then overall their assessment of Portland's age friendliness. And after the forum, we had this community conversation. We asked specifics about different areas. And I didn't bring my watch home. Okay, great. So basically, let me just tell you what this forum found and what another forum found. Basically, this forum, which was primarily community residents, thought that Portland was fairly age-friendly. 42% said fairly, and another 33% said somewhat. In a different forum that we had this last fall, which was mostly service providers and government officials, those numbers were reversed. So a lot more people actually said somewhat than fairly. So service providers, government officials' views of Portland's current status as being age-friendly were somewhat different, but sort of in the same general areas. In terms of most important aspects, because we've got these 8 topic areas, so how do you decide what to focus on? Well, housing came out in both groups as the top priority, 41% here and similar in the service provider group. Followed by transportation and then by community services. So those would be, if we had to choose just 3 general areas, that's where the bulk of community folks think we would want to focus our efforts. Skip through these. So what we're doing next is we are on yet a different advisory group for the comprehensive plan. And Alan, the graduate student, has been working on that to advise on specifically around the issue of neighborhood centers, those community hubs. I'm working internationally with WHO to develop indicators of age friendliness. So we got to meet in St. Gallen, Switzerland. That was a lot of fun. And with AARP nationally, who is the national liaison with the WHO for the Age Friendly Cities project. And then we're looking to get funding so that we can go neighborhood by neighborhood and help neighborhoods identify some areas that they could be working on to increase age friendliness. And then work with more, we need to work with more bureaus than just planning and sustainability. So what are some of the barriers? Well, one related to citizen participation. People kind of pushed back when Mayor Sam Adams proposed his Portland plan effort. They said, hey, what happened to the recommendations from that first visioning effort, Vision PDX, and said, how much planning and visioning are we going to do? When are we going to act? In most cities, and certainly Portland is a good example of this, multiple jurisdictions provide different services. So the city's in charge of infrastructure and parking. The county has social services and aging services and their helpline, which, by the way, that was something that people found very age-friendly because the helpline is a telephone hotline for aging services that's staffed round the clock by a real person. No automated. Press this for that, press this for that. People love that. And then regionally that's how transportation services and long-range planning get conducted. And like everywhere, there's a lack of government resources. So we may come up with all sorts of wonderful ideas for changes, but there is not very much money. So we are going to have to think very creatively about how to use what little resources there are and how to do things on the cheap or without funding at all. There are also competing agendas. So for example, Portland's this huge bike-friendly place. So there's the bike-friendly agenda, there's the kid-friendly agenda, there's the homelessness agenda. I mean, these are all important issues. And trying to figure out how to address the needs of all of these different organizations is a challenge. And there's really no way around it. They do compete. So trying to figure out ways to form coalitions so that everybody gets something out of it. That is the strategy that I think is going to be most effective. And this model that we have developed with how we approached our age-friendly cities planning effort is, it's come to be known by our colleagues as the university government community model, because we have worked very closely with government and have taken this planning approach. But it's problematic because there are transitions in government leadership, and so you need to make sure you liaison with the staff as well. So some of the strengths we've built on long-term relationships with the university and planning agencies. Planning is viewed as a legitimate way to make change in Portland, but not all cities rely so heavily on their planning process. So for us, it was a natural way to incorporate age-friendly concepts and suggestions into the direction that Portland might want to move, but that might not be the case for other communities. And it takes a long time. So for communities that want to move faster, it may not be the best approach. So in reflecting back on this process so far, because we had to write a journal article, right? You have to write up the results of your findings. And we were asked to write about our project for the Journal of Aging and Social Policy. And the manuscript's under review now, so I don't know whether it's been accepted or not. So we thought, what could describe what happened in this process? Is there a theory out there that can provide can serve as an organizing framework for what happened? And we worked with Paula Carter, who is a policy analyst on our staff, and she said, let's look at Kingdon's theory of agenda setting. And I think it works, and I'm going to ask you if you think it works. So agenda setting it's a competitive political process subjects vie for officials or policymakers' attention. So that's what agenda setting is. His theory posits that policy can be adopted or changed when a window of opportunity opens, permitting participants to connect at least two streams associated with the policy process. And there are three streams. Problem streams, so defining and placing the issue on the agenda. Policy streams, which is coming up with solutions, creating knowledge that can be considered by decision makers. And third, political streams, when there's a political climate and the will to place the issues on the agenda. So, in terms of how I think this works for us in describing what we did. Under problem streams, well, we know that our world is aging. The population is aging, and there's a need for local responses. We're not going to be able to continue as we have without changing something. There just aren't enough resources. So we have a problem. In terms of policy streams, coming up with knowledge and solutions, we had two formal tools that were available to us. The Portland Plan, the Comprehensive Plan, they were up for renewal, public comment, and so this gave us an opportunity to get in and move the agenda forward. And then the third one, the political stream, this is the political climate and will, we had the support of several Portland elected officials, the mayors, 2 city commissioners, and city council also approved the Office of Equity. And that gives us a little bit of a window into include aging as an equity issue as well as race and ethnicity. So my question to you is, does that model seem to apply? Does that kind of a model work for rural and remote settings? And what would be some of the differences between urban settings and rural settings? And then my last question to you is one that I've struggled with a great deal, because in my many, many years prior to becoming involved in this project, I had never played such a key role in advocacy, and that's really, I think that's translational research writ large. When you really take it to the extreme and you're actually going to these meetings and you're raising your hand and you're writing comments. So those are my questions to you, but I realize I should give you a chance to ask me questions first. So if there aren't any, then we'll go to here, but otherwise. Yes?
This is kind of based off of these questions as well, but what do you think, I guess with number 3, the role of faculty in almost forcing these windows open? If we know that there's a problem based off of our research, but it's not really a public agenda item, of trying to almost, I hate to use the word force on the public, but make the public aware, I guess, and open that window itself instead of waiting for it to be open.
If we waited, nobody would be talking about older adults at all, right? Nobody would be talking about population aging, because we are an age-denying and a death-denying society. And aging, unfortunately, is often equated with disability and death in the minds of people. We just don't really want to go there. I got to tell you, I don't like getting older. I don't like the fact that my hip hurts or my knee doesn't work as well as it used to. I don't like it. But there are some things that I love about it. And people don't talk about the good things. They talk about all of the negatives. And I just said that we don't have the resources to continue pumping into Medicare, for example. That last year of life, I don't know how many of you have seen that pie chart about where all the dollars go for healthcare. It's the last year of life. Somebody said last night, well, we just need to get people to sign an agreement that last year. I said, well, how do you know when that last year started? So, but it's a good question. I think it's education. I mean, I presented it here sort of high energy, maybe a little over the top in some places, but it was, we were providing education and giving older adults a voice and giving them an opportunity to talk about what needed to happen in their community. And that's really an important piece of this work. But faculty definitely have a role in education. When it gets to the point of writing comments and spending a bunch of time going to committee meetings, I'm not as sure. Took me a long time to write up the results of this work, because we only have so much time. And if you're going to meetings, you're not writing. So it's a tricky one, I think. Yes?
How responsible do you think the Academy is, though, for creating the very problem we're experiencing, given that most of the research, I mean, successful aging as a term, I don't think is really that old. And I think that when we start looking at the way that we report our results, whether it's HIV or whether it's aging, we really talk about the negative consequences rather than the successful outcomes that are associated with that. So we really do set up, I think, our society in a way to see these things negatively rather than positively. So, I mean, it's more than just education. It's really how we report and discuss our results.
What an excellent comment. I totally agree. Is gerontologists, up until very recently, highlighted problems, highlighted gaps, highlighted challenges associated with aging. So maybe it's no wonder that the rest of the population does that too. But we're starting to see that turn around. I mean, there's a lot of discussion now about positive aging, productive aging, successful aging, optimal aging, vital aging, active aging. There are a few more, I'm not sure. So lots of positive things.
But do you think that's because the population is now older and it matters to them? Rather than it being an important issue, it's become an important issue because now it matters, rather than it should have been an important issue all along. Does that make sense?
It does. So almost the larger the population group, the more
attention it gets.
That there's certainly some truth to that. But the first baby boomers, which is this the largest group of older adults to ever come through, they just started turning 65 last year, and the positive aging movement, for lack of a better term, started probably 10 years ago or something like that. So that's part of it. But I think it's more that people are finally recognizing that we're missing. People are not recognizing that we're missing an opportunity, as a society. But people are recognizing that, hey, we're living longer, and I don't want to sit in a nursing home in my later years, and not just me, but that's what people are saying. Nobody wants to do that. So what can they do to change that outcome? Individual behavior as well as societal.
This shift could also represent in psychology the move towards positive psychology, because the dates sound like they correspond.
Yeah. Yes. I think there is a correspondence there. Great. What else?
I have a question, kind of more of like a philosophical question. I'm new to this area, so forgive me if it's ignorant. But so talking about accessible housing. So I have an example that might explain it. I don't know. So in Morocco, they use Turkish toilets, and I feel like a lot of those older adults are really flexible because they have to use a Turkish toilet, right? So if we switch all of them to Western toilets because that's accessible, do we actually like cause atrophy of flexibility and movement and that sort of thing in housing? And is that, I don't know, is that something that housing people address?
It's a really great question. Hal Lawton had a phrase, don't be too doofer, don't be too much doing for older adults, because you can actually create disability, and that's a parallel with what you're talking about. If we build the environment so that it's too easy and doesn't create stress for people, then they'll lose function. Well, Lawton's model was so perfect because it talked about person-environment fit, and it shows that there's kind of a sweet spot where people need a certain amount of challenge, but not too much challenge, and that's where they're going to function optimally. So you don't want to make it too easy. You don't want to get rid of the steps and always use the elevator if you can climb stairs, because you will lose the ability to climb stairs. But at some point, it's not safe for you to climb stairs. You have one fall too many. You're scared, and so you say, okay, this house with these stairs is not going to work for me. So there's a window, sort of a range of appropriate settings for people. But you're absolutely right. If you make it too easy for all people, they will lose function. It's the use it or lose it thing for our minds and our bodies.
Because housing came up, I'm just curious. So, like New York, I saw that they were putting in these 250 to 375 square foot, very affordable housing in New York City. Accessible, I guess, but highly dense. But that may create other problems. I'm just curious if you, like, because New York was involved in this sort of after the fact, have you had conversations around that? Or
Is that age-specific housing?
I don't know. I don't know.
Probably general, no matter what. It's targeting younger. It's an interesting question. Density alone isn't necessarily a problem, but but it does. The mix of people can affect people's quality of life and whether they feel safe. So in Portland, a lot of the affordable housing mixes people with disabilities with older adults, and that's fine. Where older adults tend to have a problem with it is when they're mixing developmentally delayed folks or alcohol and drug abuse, homeless people, formerly homeless people. So if people don't feel safe in their environments, feel threatened, then that's not good. They won't leave their houses. They won't leave their apartments. So it probably depends on who they're putting in there. I don't think the density alone is a problem. For me, they better have sound insulation. So if they build it real cheaply and no sound insulation, I'll go crazy.
Well, I'll wait. One last question.
Sorry.
Okay. I think actually, in some countries there are adult homes, and actually, so they are excluded from the family and from the society sometimes. So what WC is doing actually to raise the awareness all over the world, this we are talking on, mainly on the USA or some developed countries. But what about the low-income countries? For the old adults, so they are suffering more than anybody. So I think the awareness building is most important. And what are the WS doing in that respect?
Awareness building about needs of older adults in developing countries. Well, that's one of the reasons the WHO was so keen to involve cities from developing countries. One of the challenges is as countries become more developed, the traditional caregivers or people who've stayed at home aren't there, and so older adults are abandoned. Or if in countries like Nicaragua, where I do a lot of work, you'll see the middle generation has often left the country because there are no jobs. And so they're working outside and sending money back, but that leaves the older adults there by themselves. So there has been some creation of homes for the elderly, for abandoned elders in places like Nicaragua. But there's no government funding. And the community, depending on where they're located, which we do the same thing here, we locate these places for older adults at the fringe where nobody can get there and where they have to drive. The older adults themselves have to drive. In Nicaragua, where we work, the older adult home in Boaco is half an hour walk away by healthy, active people. The community doesn't go up there. So we're not even sure what we can do in terms of intergenerational work there. But yes, there's needs to be a lot of attention, awareness raising. And those countries are changing really rapidly.
Thank you, Margaret. Clearly, you've really struck a chord with everybody here, and thank you for opening up the conversation about optimal living environments for older adults. I think and for everybody, not just older adults.
So
thanks so much.